Epic sepsis model predictions may have limited clinical utility. Sepsis is a serious medical condition that occurs when the body's response to an infection causes inflammation throughout the body. It can lead to organ failure and even death if not treated promptly. Early detection and intervention are crucial in managing sepsis and improving patient outcomes. In recent years, there has been growing interest in using predictive models to identify patients at risk of developing sepsis. These models use data from electronic health records, EHRs, to predict the likelihood of a patient developing sepsis based on various clinical and demographic factors. One such predictive model is the Epic Sepsis model, developed by the healthcare software company Epic Systems Corporation. The Epic Sepsis model has been widely adopted by healthcare systems across the country as a tool to help clinicians identify patients at risk of sepsis and intervene early. However, a recent study published in the Journal of the American Medical Association, JAMA, has raised concerns about the clinical utility of the Epic Sepsis model. The study, conducted by researchers at the University of Pennsylvania, evaluated the performance of the Epic Sepsis model in predicting sepsis among a large cohort of hospitalized patients. The researchers found that while the model had good overall predictive accuracy, it had limited clinical utility in identifying patients who would benefit from early sepsis interventions. One of the main limitations of the Epic Sepsis model identified in the study was its reliance on data that may not be readily available to clinicians in real time. The model uses a combination of clinical and demographic factors, such as vital signs, laboratory values, and comorbidities, to predict the likelihood of sepsis. However, many of these data points may not be immediately accessible to clinicians at the bedside, making it difficult to use the model to guide clinical decision-making in real time. Another limitation of the Epic Sepsis model is its lack of specificity in predicting sepsis. The model was found to have a high false positive rate, meaning that it identified a large number of patients as being at risk of sepsis who did not actually develop the condition. This can lead to unnecessary interventions and increased healthcare costs, as well as potential harm to patients who are subjected to unnecessary treatments. The study also found that the Epic Sepsis model performed poorly in identifying patients who would benefit from early sepsis interventions, such as antibiotics and fluid resuscitation. The model was not able to accurately predict which patients would go on to develop severe sepsis or septic shock, the most life-threatening forms of the condition, and therefore may not be useful in guiding treatment decisions for these patients. Overall, the findings of the study suggest that while the Epic Sepsis model may have good overall predictive accuracy, it may have limited clinical utility in guiding early sepsis interventions. Clinicians should use caution when relying on predictive models like the Epic Sepsis model to identify patients at risk of sepsis and should consider other clinical factors and judgment in making treatment decisions for these patients. Despite these limitations, predictive models like the Epic Sepsis model have the potential to improve sepsis care by helping clinicians identify patients at risk of developing the condition and intervene early. However, further research is needed to refine these models and improve their clinical utility in real-world settings. In conclusion, while the Epic Sepsis model may have good overall predictive accuracy, it may have limited clinical utility in guiding early sepsis interventions. Clinicians should use caution when relying on predictive models like the Epic Sepsis model and should consider other clinical factors and judgment in making treatment decisions for patients at risk of sepsis. Further research is needed to improve the clinical utility of predictive models in sepsis care and improve patient outcomes.